Welcome to the Healthcare Security Systems Guide 2026. This guide helps healthcare organizations modernize physical security, cybersecurity, compliance, and infrastructure without operational chaos. It's essential for chief information officers, information technology directors, compliance leaders, facility leaders, and security or environment of care leadership. This guide explores the convergence of physical access control, video surveillance, network infrastructure, cybersecurity, compliance, and AI-enabled managed and co-managed IT and converged cybersecurity and site safety operations. Multi-site healthcare groups, ambulatory centers, and regional clinic networks will find strategies for managing security and compliance across distributed sites. If you protect patients, data, or operations, this guide is for you. Healthcare security in 2026 is shaped by 10 strategic themes. Cyber-physical convergence treats physical security systems as cyber assets. AI-assisted cyber and physical event monitoring enhances detection and anomaly identification. Centralized governance and compliance automation streamline oversight and documentation. Operational resilience and infrastructure standardization ensure consistent security. Insurer-driven controls and Internet of Things governance set new standards, while zero-trust architecture reduces cyber risk and incident impact. This self-assessment tool benchmarks your healthcare organization's security posture across 10 domains. Evaluate your multi-factor authentication deployment, virtual local area network segmentation, security information and event management integration, and more. Progress from reactive to optimized levels, enhancing security and compliance. Optimized organizations excel in cyber insurance, Office for Civil Rights audits, and incident response. Use this scorecard to identify areas for improvement and achieve superior security outcomes. Welcome to our discussion on understanding the threat environment in healthcare. We'll explore the complexities of ransomware, workplace violence, regulatory pressures, and aging infrastructure. Notably, healthcare data breaches cost an average of $10.9 million per incident in 2024, marking the highest across industries for the 14th year. Healthcare faces interconnected physical and cyber threats. A prop door or unsecured network can be entry points. Ransomware attacks rose 94% from 2021 to 2023, with recovery costs over $1.27 million per incident. Workplace violence rates are 5x higher than other industries. Security strategies must handle both physical and digital defenses to address these vulnerabilities. Traditional security models in healthcare often fail due to fragmented technology stacks, overwhelming security alerts, and the resulting operational and compliance risks. A converged model offers the potential for improved system performance, IT staff efficiency, and risk reduction. BTI's goal is to assist clients in achieving lower-cost security operations management and improve security all at the same time. Welcome to Section 2, Converged Security Infrastructure. We'll explore how integrating physical security, cybersecurity, information technology infrastructure, communications, and compliance into a unified framework enhances threat detection, response, and recovery in healthcare organizations. Converged security infrastructure integrates physical security, cybersecurity, information technology infrastructure, communications, and compliance into a unified framework. In a phased-in manner, it replaces isolated systems with a coherent enterprise approach, emphasizing security as an architectural and governance commitment. This integration supports continuity, compliance, and resilience, crucial for healthcare organizations to manage risks effectively. The BTI Converged Security Reference Architecture integrates 5 pillars: physical security, cybersecurity, IT infrastructure, communications, and compliance governance. This unified framework enhances security, compliance, and resilience. It features AI-infused operations, collaboration between NOC, SOC, field engineers, and client IT resources to produce a single audit trail, compliance automation, operational resilience, and lifecycle governance tailored to each organization's needs. Healthcare video surveillance has evolved into an operational intelligence platform, offering real-time situational awareness and AI-enabled analytics. Modern systems detect anomalies and enhance perimeter safety. Compliance requires aligning evidence retention with Health Insurance Portability and Accountability Act and legal standards. Unmanaged cameras pose cybersecurity risks, emphasizing the need for integrated, compliant management. In healthcare, physical security systems are also cybersecurity assets. Ensure network segmentation by placing security devices on dedicated virtual local area networks. track firmware versions, and patch regularly. Implement multi-factor authentication and role-based access. Integrate converged physical and computer credentials and security information and event management for the gold standard in physical and IS Zero Trust credential security. Inventory all Internet Protocol connected devices and verify their security posture. Cyber insurance underwriters now demand rigorous audits of healthcare security infrastructure. Key requirements include enforcing multi-factor authentication, documented network segmentation, centralized audit logs, and governance of unmanaged Internet of Things devices. Compliance is crucial, as organizations lacking these measures face higher premiums and increased risk. Operational governance is essential for achieving favorable insurance terms and a resilient security posture. A converged security infrastructure enhances healthcare security operations by streamlining incident detection and resolution. It ensures comprehensive documentation for compliance, insurance, and operational review, transforming how healthcare enterprises manage security incidents. Compliance, operations, and infrastructure resilience are unified disciplines in healthcare security. They share governance, audit trails, and operational teams. This integration ensures health insurance portability and Accountability Act compliance, multi-site visibility, robust network infrastructure, and business continuity, forming a cohesive framework for resilient healthcare operations. Healthcare compliance is an ongoing discipline, not a checkbox. Health Insurance Portability and Accountability Act requires documented policies, technical controls, and audit trails. Physical access controls and audit logs are essential to avoid penalties. Compliance demands integrated, automated systems. Audit readiness involves unified logs, video retention, and incident response plans. Compliance is architectural, requiring proactive governance and structured systems. For multi-site healthcare operations, centralized visibility is crucial. Without it, each location becomes a separate compliance gap, increasing risk and costs. A unified platform consolidates access control and network health, enabling remote management. Standardized deployment ensures consistent security, reducing complexity and enhancing compliance across all sites. The BTI Global View Service Platform offers scalable, centralized visibility for multi-site healthcare security, IT, and compliance operations. It features skilled, multidiscipline support, customizable reporting and dashboards, intelligent alerting, and AI-enhanced remote system management, plus NOC, SOC, SIM, compliance, GRC tools, and more to suit each client's needs. GlobalView transforms inefficient, reactive IT and security management into highly automated, measured, proactive, and collaborative liability prevention. GlobalView is tailored to organizational technology and staffing needs, supporting strategic planning and compliance documentation. Network infrastructure is crucial for healthcare security. It supports all systems, and failures risk patient care and data. Compliance requires accurate network segmentation documentation. BTI manages and sells Cisco cloud-managed switching for visibility and security. Ekahau-designed Wi-Fi isolates traffic and ensures coverage, and software-defined wide-area network technology ensures continuity. Managed uninterruptible power supply systems maintain operations during power events. In healthcare, network infrastructure is a patient safety system. Healthcare organizations must ensure operational resilience of security systems to avoid risk. Critical capabilities include high-availability access control and recording systems, offline access control, and EHR and voice-over Internet Protocol failover. Rapid recovery demands documented procedures and trained personnel. Cyber insurance now requires tested continuity plans. BTI offers modular continuity solutions tailored to operational needs, emphasizing patient and staff safety and cybersecurity as top priorities. Welcome to Section 4, AI, Intelligence, and the Future of Healthcare Security. We'll explore how artificial intelligence is transforming operational capabilities, from predictive threat detection to automated compliance monitoring. In 2026, BTI is already deploying AI-infused NOC and SOC, vulnerability management, and GRC tools to improve efficiency and lower response times by more than 50% from 2024 levels. By 2027, AI-assisted monitoring and remediation will reduce detection times to near zero for security incidents in healthcare. Artificial intelligence is transforming healthcare security by automating tasks and reducing false positives. Key advancements include real-time anomaly detection, forensic intelligence search, and operational intelligence. Our solutions ensure Health Insurance Portability and Accountability Act compliance and integrate with security information and event management systems for effective artificial intelligence governance. The future lies in intelligent infrastructure, not more disconnected tools and alerts. BTI Communications Group employs a project management office-driven methodology for healthcare security projects, starting with a vendor-neutral assessment and progressing through design, deployment, and optimization. BTI offers flexible, tailored solutions for procurement, installation, commissioning, and managed or co-managed operations. BTI's approach ensures consistent outcomes, aligning technology investments with organizational needs and risk tolerance. Welcome to Section 5, Client Success Stories. We'll explore real-world outcomes from healthcare organizations that have modernized their security and infrastructure. Discover how these improvements lead to better compliance audit outcomes, enhanced cyber insurance terms, and faster operational incident response times. BTI supports many multi-site medical provider networks and groups. As an example, one multi-site clinic network faced fragmented security and IT infrastructure challenges. BTI implemented a phased modernization strategy, standardizing access control and centralizing compliance visibility. This led to unified governance, improved compliance maturity, and faster incident response. The organization achieved a $180,000 annual vendor cost reduction and favorable cyber insurance renewal terms. The rapid expansion of this ASC and imaging group led to inconsistent technology governance. BTI implemented a compliance-aligned security architecture using AI-enabled cameras and centralized credential management. This strategy ensured audit readiness, operational continuity, and a scalable governance framework, resulting in zero joint commission findings and standardized locations. BTI Communications Group offers a comprehensive approach to healthcare security and infrastructure, emphasizing operational discipline over mere products. Solutions are tailored to each organization's structure, compliance needs, and governance model. Services range from fully managed to co-managed, with transparent pricing and support. BTI ensures accountability across security, information technology, and compliance through a unified assessment and deployment process. Healthcare organizations need a converged infrastructure integrating physical access control, internet protocol video surveillance, cybersecurity, managed information technology, voice-over internet protocol, and Health Insurance Portability and Accountability Act-aligned compliance governance. The Health Insurance Portability and Accountability Act requires controlling facility access based on role, with audit logs for investigations. Internet protocol cameras are cybersecurity risks if not properly managed. Converged infrastructure unifies security systems under a single governance structure. BTI partners with and is certified by the top manufacturers to design converged healthcare security infrastructure. We offer AI-powered video surveillance from Avigilon and Axis, on-premises, cloud, and hybrid solutions, and converged security recording and video management services as well. Our physical access control offerings include cloud and on-premises solutions from Axis, Avigilon, Brevo, Cantech, RS2, Software House, and Your 6. HID Global's new Zero Trust, converged credential technology may be integrated for enhanced Zero Trust physical and network security. In cybersecurity, we orchestrate best-in-class tools plus our AI-infused NOC, SOC, SIM, continuous vulnerability management, quarterly third-party penetration testing, and GRC policy, controls, and compliance evidence management tools to protect clients from liability. BTI offers a comprehensive approach to enhance healthcare security, compliance, and resilience. We provide vendor-neutral evaluations to identify security gaps and infrastructure needs, delivering a prioritized improvement roadmap. Our executive advisory services offer board-level guidance across information technology, cybersecurity, physical security, voice-over internet protocol, and compliance, tailored to your regulatory and operational priorities. This guide is for informational purposes, not legal advice. Consult legal counsel for Health Insurance Portability and Accountability Act obligations. Distribution is allowed for internal and advisory use. All content is current as of May 2026.